you so much. Good morning. Well, for those of you in the back, after the introduction, I'm actually blushing, but you can't see it from the back here. I've been outed from football. I can't even go back to the community anymore with crocheting. I'm here to talk about a model that has taken us from the fee-from-service approach to fee-for-value. And I'm going to share lessons that we've learned from managing the National Football League. I'm a neuropsychologist, and we're a group of neuropsychologists, neurologists, and I'm going to talk about single and mass tort. We started with the Sports Concussion Institute. We're the largest entity that assesses, diagnose, and clinically manage concussion, sport-induced concussion, and associated neurobehavioral disorders. We've been at this for a while. We have 11 sites throughout the country, and I looked for ways to get off of that fee-for-service model for a while. And we decided that the path that we would take would be the legal area, and specifically mass tort. There are literally billions of dollars that have been allocated that are segmented for health care in this area that heretofore I was unaware of. And specifically, this first go-round for us, there was a $75 million set aside to do neurologic and neuropsychological evaluations. We emerged as the largest entity providing those evaluations for the retired NFL players, and fully 20% of all the NFL players in the country, my group has evaluated as a part of that billion-dollar concussion settlement. We learned a lot with working with that group and developed a particular therapy to treat post-concussion syndrome that we're developed from in a telemedicine environment. So we took our particular interest in a population, and telemedicine was necessary for us to be able to extend our clinical service. So our telemedicine was the driver in terms of us to be able to evolve. And our next settlement that starts in the next 60 days, we have to screen, there's going to be 4 million individuals screened as a part of the NCAA concussion settlement. It's a huge number of individuals. And therefore, the old brick and mortar way of which we saw the NFL players, it's impossible to see this cohort in the traditional brick and mortar method. And specifically, the NFL players are elite individuals who will not tolerate poor patient experiences, nor will they tolerate long wait times. They were upset enough having to wait years for the settlement. So again, the necessity relative to telemedicine to be able to service a large vector of individuals. So we thought to ourselves, how can we improve upon this process? How can we enhance the patient experience, drive more engagement, drive more adherence? And we took our thoughts back to the individuals who were making the decisions, and specifically the Garrison Resolution Group, which is the largest entity that nobody's ever heard of. They manage billions of dollars. And we said that we have a way of doing it. Now, relationships are extraordinarily important. We truly believe that 1 and 1 must equal 5. You must have the relationships, these partnerships must drive significantly more than additive value in order for us to be able to execute on our plan. And we have a number of very, very important partnerships that we've developed up to this point, and we are looking to extend those partnerships, and hopefully I'll be working with some of you. I'll be here today. And we're inviting you to expand with us, but up to this point, we've had tremendous success. We're part of the National Sports Concussion Coalition. This is the largest entity. These are the sports governing bodies that manage the 60 million youth and adolescents throughout the United States. So we have significant first mover position to access populations of interest to us. Moreover, I mentioned GRG, this opportunity in terms of being able to play in this space for these APM, or these alternative payment methods, extends beyond just the mass tort dollars that have been defined by Garrison Resolution Group, which are substantial. In fact, we are interested in now turning our particular interest to the single tort space. What is that? This was kind of driven from the fact that you have a concussion settlement, mass tort, $1 billion set aside, you service that, then you wait until the next catastrophic event. Well, there's a gulf there. I had to generate and think of a revenue stream that was available to me each and every day. And then I thought, as we looked, every single day in the state of California, there are 15,000 automobile accidents a day. So I have 15,000 new opportunities every single day. So I refocused the effort to single tort, expanded using mass tort as sort of our steady state revenue stream, but our growth vector's right here. This is where we're going, and we just were successful in getting a nice contract that I heard yesterday at 4 o'clock. I'll give you the details. Our partner, Milton, that'll allow us to access 9,000 lives for telemedicine that we're going to start fairly soon. So we've done a great job, I believe, in terms of baselining. We baselined hundreds of thousands of individuals over the past 15 years as a consequence of what you do in sport before they enter the field. We've learned a lot about neurobehavioral status before and after, but you can see that the data points of capture are far more vast than that. So I want you to imagine the possibilities here beyond simple reporting, the medical monitoring that we're quite good at. We want to go in this particular space here. It's about AI. You've heard a lot about AI. We believe that this is the next iteration in terms of how informatics data are going to be managed, how we enhance healthcare. So we invite you, if you have an interest in this space of mass tort, it's been, and single tort, there are billions of dollars that have been segmented and available, and I want to thank you for your attention.
Thanks, Tom. Time for some questions. Okay.
You can yell it, maybe I can hear it.
Tony, thank you. I'd like to know what measures perhaps have been looked into to prevent concussions. I know they're going to be inevitable, but particularly in football with helmet and other things. Could you comment on that? And are you involved in that at all in your work?
Yeah, we've seen, the question was about, what about helmets? We've seen every type of energy attenuation device that's out there. We get things pitched like on a daily basis. Our focus right now has been on acquiring, because concussion is not a 5-minute clinical encounter. So we have spent time on acquiring tools such as we own our own cognitive tests. It's nested, it's embedded into the telemedicine platform. And so it's being able to track those neurobehavioral metrics over time. Last thing is, aside from the clinical interview, we have, because of our diversity in our country, we also have a version of our neuropsychometrics that's in Spanish as well. Yes.
For these mass tort settlements, are the payments coming from the NFL, for instance, or are they coming from payers, or is there a different payment mechanism?
Yeah, the payments are coming from the money's already been decided. When there's a settlement, they take the dollars and they put them over here. And the over here is Garrison Resolution Group. They're just an administrator. They have one job. They take money, they give it to providers, and they pay claimants. That's it. And until it got my attention, I had no idea that it was sitting over there. There's a large vector of money in the legal area that we're just totally unaware of. Yes.
Tony, I love what you're doing here. Can you talk a little bit more about the single tort that you're pursuing and how that's going to work?
The single tort is really interesting because, again, it was out of necessity when we were waiting in between. We had to figure out a way, how do we keep the revenue and keep the doctors happy? And we had to, and that's why pretty much 15,000 accidents a day, 20% of those involve head or neck, so that was an opportunity for us to play in that space.
Maybe
Good
one
morning.
last question. Okay.
Thank you so much for your presentation. I'm a clinical psychologist, and automatically my mind is pinging and thinking of this as an opportunity. Are you aware of any treatment, tort actions, anything like that for clinical psychologists?
Well, I think the short answer is yes.
Okay.
But unless it's a defined benefit, what I have learned is that, unfortunately, the settlement is the settlement. If the settlement for the NFL was a neurological evaluation and a neuropsychological evaluation, and they're not going to spend a penny on anything other than that. Now, what we learned is that virtually all of those patients needed treatment. So we've been managing those patients for headaches. We've been managing those patients for anxiety. We've been managing those patients for depression through other mechanisms. But the tort is tethered to whatever the parties agree to. Yes?
I have a big mouth. So, as a company, are you at all, more globally going beyond NCAA and going beyond NFL? You probably know where I'm going with this. Are you at all addressing this at the lower levels, like at the high school level, from a preventative /evaluative?
We started at the lower level. We've been doing that for 15 years. We've done that more than anyone. Now we're expanding this. There are a lot of players now. This is about unique alternative pay vectors. How do you grow the opportunity and specifically define revenue streams that have not been identified heretofore? That was our strategy.
Thank you so
Thank
much.
you
That
so
was
much.
Awesome.
All right, man.